me. I'm Christy Campbell, the Director of the Health Department. Thankfully, our case numbers for positive cases of COVID have remained low, and so have our hospitalizations. We're really happy to hear that. We've been getting a lot of questions here at the Health Department about Tier 3 that the governor has activated on Monday, March 15th, what is included, and we've also been getting a lot of calls for vaccine. And I do want to reiterate that the supplies have still been fairly low, and just because those tiers have been activated doesn't mean that all of the providers have enough vaccine to accommodate everyone that's in those tiers. So even though your tier has been activated, we're still asking for you to be patient as we're still waiting for our vaccine supply to increase and for those appointments to be available. I do want to share my screen really quick because I want to talk about who specifically is in that Tier 3. We're getting a lot of questions. So if you go to the covidvaccine.mo.gov website and scroll down, you can click on any of these tiers, and it'll you can pull up the list of who is included in Phase B Tier 3, which is critical infrastructure. So the first group is education, and that is specifically pre-K through 12th grade. The next one is childcare, so facilities that are at a licensed facility providing basic care to children or other childcare facilities. Communication sector, so if they provide communication services. Dam sector, energy sector, so that are, energy services. Food and agriculture, so these are food production and processing facilities and the related operations to food mass production, distribution, transportation, wholesale and retail sales. That includes grocery and convenience stores where groceries are sold, and it includes veterinary services. Government, so elected officials in any branch of the state, county, or municipal level that are required for the continuity of government. Members of the judiciary at the federal, state, and local levels for the continuity of government. So when we talk about continuity of government, those are those employees that if they were not there to do their job, the government could not continue to function without them. So it might not be a staff person that just works in an office answering phones. It's more like city council, mayors, county commissions, those elected officials or other government employees that are needed to continue the operations of government. The information technology sector, so those employees that provide information technology services, people that work at the nuclear reactors in the materials and waste sector, transportation, and wastewater. And if you need to get a little bit more info, you click on the full eligibility list and go down to here, this Phase 1 Tier 3, and there's a little bit more detail, and you can click on these links and it will take you to pages that explain those sectors just a little bit more. So please feel free to access that covidvaccine.mo.gov website if you have questions about which tier you're in or if you qualify for a tier before calling to get an appointment. And the other thing that we've been getting a lot of questions, of course, is our March 19th National Guard event. That is going to be a National Guard supported mass vaccination event. Again, all our community partners are going to help with the vaccine administration and organization of that event. There will be appointments available next week, but at this time we are currently scheduling the educational staff first to accommodate some of their schedules with late starts and early releases. And once those educational staff are scheduled, then we will be able to open it up and schedule more appointments. Dr. Barg from Capital Region Medical Center is going to give us an update today as well. So Dr. Barg.
Yeah, so I just want to speak to the, as we're working through each one of the tiers and moving from tier to tier, that front end tier, the end of Tier 2, we're getting to a point where we're running low from a list perspective as we're trying to fill clinics. And so we know that the community, and as you come into a tier and you're eligible to receive the vaccine, that patients are very anxious to get that vaccine and have gotten onto any list they can possibly get onto so that they can get that vaccine in as quick of a fashion as possible. I think one thing that as we're coming to the end of our tier 2 and getting ready to move to tier 3, we're recognizing is we have a lot of lists that we've been generating and using to fill our mass vaccine clinics. And we've come to a point now where we might have to make 6 phone calls before we actually find a patient that hasn't had their vaccine yet, which is wonderful. We're thrilled that we're getting patients vaccinated. One thing that the community could do to help us is that if you have received your vaccine through whichever list you and entity you've been able to get that vaccine through, if you know you've been placed on multiple other lists, if you could reach out to those other folks that are managing those lists and get your name off of that, that would really help to expedite getting additional people vaccinated. Additionally, I would also encourage you to, if you have received your vaccine and you've not received it through your primary care provider, that you reach out and contact your primary care provider, because we can also document that within our electronic medical records. And that will also help us as we are trying to work through additional tiers to really filter through our patients that really need to receive that vaccine. So we can also be helping to reach out to you to get you vaccinated when you fall into a tier that you become eligible for the vaccine.
Thank you, Dr. Park.
You bet.
Go ahead.
Nope,
Thank you.
that's it.
Dr. Sullivan with the Community Health Center of Central Missouri.
Good morning. I'm going to share my screen and I'm going to walk through the Vaccine Navigator again. We did this last week, but I just wanted to make sure everybody understood the process. So let me share my screen here. So Christy did kind of go over this a little bit with the different tiers, but I just wanted to make sure that everybody understood that the Vaccine Navigator, you get to the Vaccine Navigator by going to this same website, the covidvaccine.mo.gov. So when people talk about Vaccine Navigator, it's the same as this website. So if you are interested in signing up through that Vaccine Navigator, then this would be the website you go to. If you have any questions about the vaccine, you can also find that information here as well. So if you want to sign up for one of those mass vaccination events in our region, you would go to the Register Now tab. That then will take you to the Vaccine Navigator website. So, and again, we've said it before, but just as a reminder, if you do not have access to the internet, you can call the 877-435-8411 number to get scheduled. And so anybody can register for the Vaccine Navigator, and it will notify you when your tier is available for vaccines. So if you go to the Register Now button, it'll link you to the Vaccine Navigator registration site, where then you will complete a survey that will ask you for your name, contact information, and then it'll also take you through the different questions for the tiers to let you know whether or not you're eligible for a vaccine at this time. So even if your tier's not up, you can go ahead and register for the website and it will notify you when that time is. If you're interested in knowing if we have any events in our region, if you go to the events tab, you can see what's going on across the state. And in particular, you can go to Region F and it'll tell you what's available in Region F at this point in time. So just wanted to make sure everybody understood that Vaccine Navigator is the same thing, the same website as the covidvaccine.mo.gov website. So that's all that I had to share today.
Thank you, Dr. Sullivan. I think there's been a lot of confusion about Vaccine Navigator, so I'm hoping that these tutorials that you're giving help ease some of that confusion. Ron with JCMG.
Good morning. So JCMG is happy to let everyone know that similar to the hospitals and other agencies in the area, we're seeing a considerable decline in the amount of patients that are presenting with COVID symptoms and associated testing. So we're fantastic to be seeing that as well. JCMG started to provide the Johnson & Johnson vaccine to patients this week. We actually had additional vaccines through the Lake Ozark Regional Hospital we were able to secure, and so we've been giving those to our patients. Wanted to kind of point out a couple of differences with the Johnson & Johnson vaccine and dispel maybe some common rumors and or misconceptions about the vaccine. You know, one of the biggest things with the Johnson & Johnson or J&J vaccine for short is the way that the instructions for the vaccine are delivered. With the Pfizer and the Moderna, they're using the mRNA technology, but Johnson & Johnson actually started with an adenovirus, which causes the common cold. You may be familiar with that term, but they modified it so it really can't make anybody sick. They then used this virus, this harmless cold virus, to develop the blueprint from which the protein spike is delivered to the cells. So very similar to the mRNA then, when it sees that, it recognizes the spike and then it determines that to be the coronavirus and is able to address it from there. This technology has been around for many, many years actually, and was used to develop the Ebola vaccinations. And so it's a safe and trusted technology. To be clear, the J&J vaccine cannot give you the cold virus, and it definitely cannot give you COVID. So again, one of the common questions we hear is it's going to give me the cold or it's going to give me COVID, and that just simply isn't true. One of the benefits with this technology is that the Johnson & Johnson is one shot, one and done. Many people have heard that, whereas of course the Pfizer and Moderna continue to require two to achieve full efficacy. The Johnson & Johnson vaccine is more stable. It can be kept at refrigerator temperatures for several months and doesn't have the same cold chain parameters that the Pfizer and Moderna vaccines do. So it makes it a little more flexible in being able to provide that to patients. The biggest question we get, of course, is efficacy, and that's one of the things that patients are most concerned about. When you hear and talk about efficacy, it's kind of hard to compare the Johnson & Johnson vaccine to the Pfizer and the Moderna because they were actually studied over different time periods, and so it really isn't fair to compare one to the other two. I think if the situation had been reversed and the Johnson & Johnson vaccine came out first, everybody would be perfectly happy to get the Johnson & Johnson vaccine. Current studies show that it's up to 85% effective in preventing severe illness and almost 100% against hospitalizations and death, the same as the Pfizer and the Moderna. And so it's just every bit as good as the vaccine as the Pfizer and the Moderna in terms of preventing that severe illnesses and hospitalizations and death. And so that leads us kind of into the next question is about why I want to choose which vaccine I get. And unfortunately right now, that really isn't an option. What we're advising, of course, is that you are able to receive whatever vaccine is offered to you. The best vaccine is whichever one that you can get the soonest. Our continued supply constraints don't allow us to really provide a choice to patients right now. The supply varies from week to week, and what we have is often what we have for that week, and so we recommend that patients receive whatever vaccine is offered to them. Thank you.
Thank you, Ron. Dr. Adams?
Good morning. Guidelines about masking, and so this is kind of an exciting milestone in so I want to share with you what those recommendations are. So first of all, these recommendations apply to fully vaccinated people. So let's define what fully vaccinated means. What they mean by fully vaccinated is that you've had your fully robust response to the vaccination. And so that would be 14 days after your vaccination. So if you're getting the Pfizer or Moderna vaccine, which is the 2-shot series, it would be 14 days after your second shot, or if it's the Johnson & Johnson vaccine, 14 days after that single vaccination. And at that point, you're considered fully vaccinated. So what does this change for you if you are fully vaccinated? Well, first of all, unvaccinated people can gather together indoors without masks on. So I could invite Christy over to my kitchen and we could have a glass of wine together, for example. Secondly, a fully vaccinated person could go into the home of an unvaccinated person, one home, one household, and visit. So I think this makes me think of a grandparent visiting their unvaccinated grandchildren in their homes. And then thirdly, if you are fully vaccinated and you've been exposed to someone who does have COVID, you do not need to quarantine or do any other changes. But if you did develop symptoms, you would want to seek care to find out if you unfortunately would have contracted the virus, because as we know, the vaccines are not 100% effective. So what hasn't changed? What has not changed is that we still need to take steps to protect ourselves in public. So that means maintaining those safe behaviors like the distancing, the hand washing, and the masking while in public, or if you're in moderate to large sized gatherings, you still do want to maintain your masking. Also, as I've said before, the vaccines are not 100% effective. So if you do develop symptoms that you think could be consistent with COVID, you would want to isolate yourself from others, not go out and seek care to find out if you do have a COVID infection or not. So we're still learning about the vaccines. I've had a lot of questions about when do I need my next vaccine from people who've already been vaccinated. And they're like, well, I'm getting close to this 3-month period or the 6-month period. Should I be preparing to be revaccinated? And the answer is we don't know yet. We haven't had enough time pass to know exactly how long those vaccinations are going to provide immunity, and that's still being studied. But as soon as they give a recommendation on that, we will make sure to let you know. And that's all. Thanks, Christy.
Thank you, Dr. Adams. Commissioner Bushman?
I don't have that much to say. I just want to thank all of our medical partners. You know, we're working toward the vaccination clinic next Friday, March 19th. Tier 3 kicks in on Monday, and I want to thank the governor and Dr. Williams for helping us get this clinic going next Friday. So I think, you know, we've got a great partnership, and the state is helping us as well. But the team that's here, you're all fantastic. So thank you very much.
Thanks, Sam. I would agree that we do have a really great partnership. Dr. Sullivan was sharing yesterday with her board that, you know, this is probably a very innovative partnership and not replicated anywhere else in the whole state. So we do have a great group that works behind the scenes to make sure that we redistribute vaccine to those who need it or those who have the resources to get it out quickly. We work together very well, and I'm very thankful for this partnership. I don't think a lot of other local public health directors are in the same position I am to have such a great group to work with. So, Mayor Turgeon.
Thank you. Agree completely on this wonderful partnership, and please take this information that's been provided today and share it among friends and family. It will be posted on social media. You can share it that way. But just ask that everybody take a moment and have that discussion with your friends, family, coworkers as things begin to move forward, so that you can do that in a safe manner and make sure you're still taking those precautions. But don't take that all for granted. Make sure that you have that plan and discussion so that we can continue to move forward safely, and really appreciate everybody's cooperation. Thank you.
Thank you. At this time, we would be happy to open it up to questions from the group, or if anyone has any other comments.
Christy, I did want to mention and echo Dr. Barg's comments of reiteration of letting your healthcare provider know if you have received your vaccine elsewhere. Similar to them, we're calling 20 or 30 patients actually before we get to a patient that needs to be scheduled. And it's just really slowing us down in the ability to provide vaccinations and get those patients scheduled that still need one. So please reach out to your healthcare provider if you received your vaccine elsewhere, so we can get you off our list. Again, it's great you've gotten it. We're happy about that. We want to be able, though, to get those patients in that still need it.
Yeah, I would agree with that. And then I would just ask for patience as well. You know, we really got inundated with calls yesterday about tier 3, and, you know, the vaccine supply is still low. And we just ask everyone to be patient and realize that we're doing our best to respect the tiers. And we would ask that people really follow the tiers and be honest with what tier they are in, because, you know, the tiers were established to target the groups that are at risk the most. So, and you know, I think the governor has also said by jumping the tiers or lying to get your vaccine quicker than someone else, it's just delaying us moving through the tiers faster. So we would really ask everyone to respect the tiers and have patience as we work through them as quickly as possible and as the vaccine supply allows. So if there's no questions for the group, I'll let you enjoy this rainy day and see you next week. Thank you.
Christy, are you still on?